right, so welcome. Tonight's discussion is called Everything I Wish I Learned in Sex Ed. I'm Dr. Fahimeh Sasan. I'm the founding physician of Kindbody. We are so excited to have all of you joining us tonight. One of our missions at Kindbody is to really empower with education, and this is exactly the focus of our discussion tonight. We recognize that regardless of your socioeconomic status or your education level, many of us fundamentally lack a lot of principle facts as it relates to our health and our sex lives and etc. So I'm joined tonight with happen to be two of my favorite people, Dr. Jasmine Pedroso, who's joining us from our Kindbody location in San Francisco, and Dr. Rebecca Nelkin, who's joining us from our Kindbody location in Century City in Los Angeles. So on behalf of our entire team, again, we thank you for being here. Tonight's discussion, you can go ahead and advance the slide. Tonight's discussion, we'll start by just giving you an introduction to who we are. Kindbody is a national network of women's health and fertility practices. As I just mentioned to you, but the three of my colleagues and I that are here, I'm based in New York. We're in San Francisco and LA, Princeton, New Jersey. We also have locations opening in Atlanta, Georgia, and in Orlando and Austin, Texas. Just a few to mention, just in the upcoming weeks, we're also opening in Los Altos in the Palo Alto area on March 22nd. The three of us are all OBGYNs. As I mentioned, I'm the founding physician. Dr. Jasmine Pedroso is minimally invasively trained. So she does laparoscopic and robotic surgeries. And then Dr. Nelkin is an OBGYN, also urogynecologist. We all consider ourselves fertility specialists as well, and this is an area that's very near and dear to all of our hearts. And so again, we welcome you for being here. The three of us will kind of tag team this topic. Please enter your questions in the chat if you have them. Please know that any question you have is a question that I assure you 10 of other listeners will have as well. This is really meant to be a safe place to ask those questions and to really have an open dialogue. But if you do have questions that you don't feel comfortable sharing, please go to navigator@kindbody.com and email us. We'll be happy to help you with that as well. And then if at any point during this conversation you would like to make an appointment to see one of us or any of our other esteemed colleagues, you can go to kindbody.com and you can schedule appointments virtually online. Okay, so we'll get started. So what we do at Kindbody, just to kind of give you a scope, is we do the entire array of gynecologic services, everything from well-woman exams to urgent gynecologic visits, pap smears, management of abnormal pap smears. We do contraception, IUDs, pelvic pain, endometriosis, incontinence issues, ovarian cysts, fibroids, and sexual health issues as well. So truly an all-encompassing gynecologic experience. In addition to that, we do the full spectrum of fertility care, including intrauterine insemination, IVF, egg freezing, embryo freezing, as well as just fertility assessment. So maybe you are thinking about having a child in the next year, or maybe you're putting off having children for another 10 years, and you just want to learn more about your body. That fertility assessment become an instrumental part of knowing more about yourself. And then as an adjunct to these gynecologic and fertility services, we also have counseling and support. We love to take care of our LGBTQ community and the special resources that you need in addition to be able to have your family building dreams come true. We do donor egg, donor sperm, surrogacy, as well as wellness and nutrition as it relates to our mental health, because we know that if we're only taking care of your uterus and vaginas, we've colossally failed you. And so the mental health and nutrition are really important aspects of our care. So that's just a little introduction to what we do. I'm going to hand it off to my esteemed colleague, Dr. Jasmine Pedroso, who's going to walk us through some slides, and then I'll be back with you guys in a little bit. Jasmine, you're on mute.
There you go. All right. Thank you so much, Dr. Sasan. Again, I'm Dr. Jasmine Pedroso. I'm Kindbody's gynecologist and surgeon for our San Francisco location. And I can tell you that I am so excited to be talking to all of you about these very important topics. And I just want to, again, encourage you to ask questions. No question is too taboo for us. We love these questions because, again, our mission is to educate, and through education, we can all be healthier. So I do want to just talk about sex a little bit. Go ahead and go to the next slide, Amandalyn. So unlike what we are used to hearing, sex for us, especially in the fertility world, is a good thing. It can be a good thing. And, you know, I know that growing up in a sort of conservative household, it was always this fear talking about sex and even having sex and all of that. But you should never be feeling bad about having sex or wanting better sex, especially when it comes to building your family. But you have to make it good for you. So how do we actually make sex better? How is sex good for our health? So it actually has so many ways that it boosts our health. It can boost our immune system. It can decrease our blood pressure levels. It can decrease our stress levels. It actually helps keep our estrogen and testosterone balance in line. And it can actually improve your libido as well. It is a form of exercise. You actually lose about 5 calories per minute. So the longer, the better, I guess. And it can also actually decrease pain, especially if you do have orgasm. All those good endorphins get released, and your chronic pain or acute pain can actually decrease. And of course, it improves the quality of sleep. Now, what also makes for good sex? So the number one thing, and again, part of our mission, is just to make sure that you know what you're working with. Knowledge of your body, of how it works, is so important to actually making sex work for you. And part of that starts with an annual exam. We will kind of guide you through it. What we do at Kindbody is we talk all throughout your annual exam, make sure that everything is healthy and running. But it also involves a lot of self-exploration as well as masturbation, which none of us are too ashamed to talk about. It also means open communication and honesty with not just yourself and your needs and your likes and dislikes, but also open communication with your healthcare provider. We want to hear about any issues you're having, and any open communication with your partner as well. What it also means is control and knowledge of your fertility. You know, sometimes people are hesitant to have sex or can't have good sex or orgasm because there are too many things on their mind. What if I get pregnant? What if I have my period during sex? Those kinds of things. Or what if I'm not ovulating and we're having sex? Am I doing it at the wrong time? So we want to kind of go through all of those issues. So we'll start with the annual exam. So what is an annual exam? What's a well woman exam? So people come in and they say, all right, I'm going to get a pap smear, but I just want to let you guys know that there's so much else that we're checking when you come in. So first of all, hopefully all of you have had annual exams before, but we review your medical history. We talk about everything, your medical problems, surgical history, any pain, any incontinence, any little thing that you might be feeling, any issue you might have. We do want to at least address it and begin a diagnostic process, that kind of thing. We always do a clinical breast exam. We always do a pelvic exam. That has nothing to do with a pap smear, but we also do the pap smear, and we don't actually have to do a pap smear every single year. Now our screening guidelines for cervical cancer and screening for HPV is every 3 years in women who've never had an abnormal pap in the past, and annually for people who've had a pap that was abnormal in the past. But again, just because we're doing a pap smear, it doesn't mean that we're not checking anything else. We're checking your uterus, your ovaries, your tubes, the vagina, the outside of the vagina. So I do want to go over the anatomy in so much detail as it relates to sex and fertility as well. So again, knowledge is power, especially when it comes to sex, having good sex and having the ability to control your fertility. So some fun facts here, just the lower vagina, it actually has different nerves than the upper vagina, but let's kind of go through, the different organs. We all kind of talk about our anatomy as if it's only the uterus, ovaries, the tubes, and the vagina, but there's so much more. I do want to start out with the ovaries a little bit. They're near and dear to our hearts as fertility specialists. They actually originate, the hormones that stimulate the ovaries actually originate from the hormones that come from our brain. The brain hormones then secrete the estrogen and progesterone that causes our menstrual cycles and results in ovulation. But unlike this drawing that we have here, just think of the ovaries as mobile. They're connected to the uterus, but think of them as kind of like dangling earrings off the side of the uterus there. They can actually twist and turn, and they can flop around one side or the other. And think of the fallopian tubes as kind of the tunnel to the uterus. This is how the ovaries, once they release an egg, that is the passageway through which that egg has to flow and where the sperm and the egg will actually meet in terms of fertility. Now the uterus, unlike this drawing as well, it actually comes in very different shapes and sizes. So some uteruses can be tilted forward, some can be tilted backwards. They have different shapes. You can have a heart-shaped uterus, you can have two uteruses. Some uteruses are bigger than others, but the anatomy of the uterus itself, it does change with childbirth, it does change with time. It changes with your cycle. It can be more swollen at some points of your period versus the other. And this is, again, where our babies grow and where they get all their blood and nutrients. Now, something that we don't talk a lot about is the actual vagina. So again, unlike this drawing, the vagina is also mobile, stretchy, and muscular. Like a penis, the vagina actually has some erectile tissue. So it actually becomes engorged with blood during arousal, and it actually elongates like an accordion, and it can expand and stretch, and it can also contract. In fact, the lubrication that we get during arousal, it comes from the blood flow through the walls of the vagina. It exudates through the vagina, we say. And this is why when there is no good arousal period, sex can be painful. The vagina is shorter. It's painful because it's shorter. It hasn't expanded. There's not enough lubrication. And so, tell your partner's arousal is very, very important for making sex work for you. Now, some people think that the vagina is our sexual organ. This is how we orgasm. But women, hopefully we all know this, that we actually have many sexual organs. So we're going to go into my favorite. Next slide. So the clitoris. So fun fact about the clitoris is 50 times more sensitive than the head of a penis. It has about 5,000 to 8,000 nerve endings. This is pretty amazing organ. But something about the clitoris that I'm sure we all know, it actually is an organ that's not really well known. And it has to do with, the medical community not really acknowledging it. In old textbooks on female anatomy, it was completely eliminated, actually. And it really embodies these misogynistic fears that women can actually find pleasure without the use of the penis. The penis is irrelevant sometimes when it comes to orgasm. And that's kind of again, a misogynistic, very paternalistic sort of thing of the past. But something I do want all of you to know is that, as someone who's done reversal of female genital mutilation, the clitoris is really this very underestimated organ. It actually is equivalent to the same erectile tissue in the penis. It can, again, engorge with blood, become erect. It has different parts, and you can see that the clitoris is not just that little button at the top of the vagina. It actually has legs that are within the labia minora, the inner labia, and they also become erect as well. So in women who who undergo gender affirmation surgery for trans women, we actually make the new clitoris and the part of the vulva out of the old something called the bulbospongiosum, which is actually part of the penis. And this is how they're still able to orgasm through clitoral stimulation in trans women. So going back to orgasm, it's not just the clitoris and the vagina that has to do with orgasm. There are many ways to orgasm. You can orgasm through clitoral stimulation, through cervical and vaginal stimulation, with the G-spot, which we'll go into detail of, uterine stimulation, but anal stimulation as well. And this is kind of why that happens. So if you look at the spinal cord, as the nerves come down into the pelvis and travel through our pelvic organs to the vulva, it's the same nerve, we call it the pudendal nerve, that helps to innervate part of the rectum, part of the vagina, part of the labia, definitely the clitoris. And this is why for some women, anal sex is how they orgasm best. For some women, it's during clitoral stimulation. For some women, it's through G-spot innervation or G-spot stimulation. It all really depends on their personal brand of how that pudendal nerves travels through their body. So if we talk about the G-spot a little bit, again, it's only one way to orgasm, but the G-spot, it actually is not a spot. It's just actually an area where there are more sensitive nerves and a bundle of nerves. And this is exactly where it is in this schematic. If you don't know, it is not deep, deep, deep in the vagina. It is not at the clitoris. It's actually about 2 or 3 inches inside the vagina on the top wall of the vagina. And embryologically, this is where the prostate would be. So if you think of men and their orgasms, the prostate is the equivalent of the G-spot for women. And so again, going back to, I've learned so much by watching my colleagues do gender affirmation surgery. Trans women can still orgasm through their G-spot, which is their prostate, after gender affirmation surgery. And this is why there definitely is an equivalency in terms of, the G-spot, the prostate, and how women orgasm. Now, the next sort of, now that we've kind of gone in detail, with the anatomy, hopefully this is not all new, but masturbation really, really matters. Practice makes perfect. In terms of experimentation and honest communication, again, to make sex work for you, to have good sex, you really have to kind of understand your limits, your likes, your dislikes, and you don't really know until you actually try things out. So this is just kind of a menu of sex toys. Not everyone is going to be right for one particular person. Sex toys come in different shapes and sizes, flavors, that kind of thing. And it's something that we highly, highly encourage. Again, you got to be honest with yourself, what you like. Definitely be honest with your partner and your healthcare provider. It is not just all about G-spot orgasms or clitoral orgasms that can actually make make sex good for you. One thing that we do know from the Masters and Johnson studies back in the 50s through 70s, when they did experiments on orgasms and sex, is that the best way for women to finally achieve orgasm, if they've never achieved it before, is through directed masturbation, where it's actually, they try different things, but they know where to go. They have an understanding and knowledge of their particular anatomy, and they're guided either by their partner, their provider, a counselor, and after which about 90% of women who previously never had orgasms can actually have an orgasm after sessions of directed masturbation, which is really key. In terms of baby making sex, I do want to make sure that, you know, when it comes to fertility, it is a stressful situation. It can make just more stress and all of that for everyone. So I do want to make sure that to acknowledge that it can affect your libido significantly. So without further ado, I'd love to hand this off to Dr. Nelkin, who will talk about your fertility, and so that we know a little bit more about that before moving forward.
Thanks, Dr. Pedroso. That was fantastic. I wish that had been my sex ed back when I was in 6th grade, but I'm glad that we're all learning this now, and let's apply it to our fertility. So the ironic fact about fertility is that many of us spend so much time and effort throughout our lives trying to prevent pregnancy. And then when we finally decide that we are ready to try to get pregnant, we realize it can be a lot harder than we had anticipated. And many of us don't even actually know where to begin. So we are here because we want you to know your fertility. Time and knowledge are very important factors, and we believe that it is imperative to provide reproductive health, sexual health, and fertility care for our patients. So, as I was saying, basically a lot of energy goes into preventing pregnancy, and when it's time to start, maybe we don't know where to begin. So that's why we're having this conversation today, and we want to address that. So first of all, it's important to remember that our bodies function as a whole and respond to our everyday routines and environments. So anything that affects our body and our overall health is also going to affect our fertility. So when you're thinking about getting pregnant, this is a really great time to do a check-in and make sure that you are taking good care of yourself. So that means healthy diet, healthy lifestyle. Of course, you want to be incorporating exercise. If you're a smoker, now is the perfect time to kick that habit. As far as drinking, you want to limit your alcohol intake. Family history is always an important thing to look at. Whatever you might be genetically predisposed to can affect your overall health, your fertility. Nothing stands alone. And of course, most of all, your mental wellness really affects your physical wellness and your fertility. So do the things that make you feel good, whether it's meditation, exercise, if it's acupuncture, if it's masturbation, if it's sex, whatever it is that feels good to you, make sure to incorporate that into your routine going forward. So what we want you to know is that when it comes to our reproductive health and fertility, really the most important thing to focus on is age. So as women, we're born with all the eggs we're ever going to have. Unfortunately, we do not get to make more eggs. We're born with about a couple million eggs, and by the time of our first period, that number is already down to a couple 100,000 eggs. And then every month, that number decreases again by about 1,000. Whether you're menstruating or not, whether you're on birth control or not, that's unfortunately kind of the unfair reality. So you probably hear everyone talking about age 35, and doctors do point to 35 as the age at which fertility declines, but it's not like your 35th birthday, all your eggs are just jumping off a cliff. The reality is that it is a gradual decline, as we saw from the time of your first period. The decline becomes more accelerated between 35 and 40, and then even more so after the age of 40. But remember, every woman's body is on its own journey and on its own pace. And unfortunately, 1 out of 10 women are going to experience premature low ovarian reserve even before that age of 35. So in addition to egg number, we also like to talk about egg quality. Those are the two things that actually decline as we get older. So poor egg quality, what does that mean? that can translate into an increased risk for miscarriages and also increased risk for chromosomal abnormalities being passed on. So the reality is you're never too young or too old to learn more about your fertility, how it works, and where things stand. So please be proactive. Okay, so the fact is that out of the whole month, there are actually only 5 days in which you can get pregnant. So this is your fertile window. And so it's important to know when those days are so that you can take advantage of them. So the idea is that you're fertile 5 days before you ovulate. You want the sperm there waiting for the egg and not the other way around. So ovulation is going to happen 14 days before your next period. So if you are tracking your period and know how long your cycles are, you can kind of count backwards. So 14 days before your next period is your ovulation. So then the 5 days before that is your fertile window. So said otherwise, if you're lucky enough to have a 28-day cycle, it's easy, and your fertile days will be day 10 through 14. If your cycle is longer or shorter, you can kind of do the math and adjust for that. So how does ovulation work? Well, Dr. Pedroso kind of addressed this, but just to review again. So every month, your body is going to recruit a group of eggs from your ovaries to start growing and maturing. So your brain sends hormones down to this batch of eggs to help one of those, just one of those in a natural cycle, will grow and fully mature and be released, and that's ovulation. And so, okay, now that we've talked about how to calculate when is your fertile window and what does that mean is happening in your body with ovulation, I just want to make sure that we're all clear on what it is that we're supposed to be doing during that window. So if you are in a heterosexual relationship, this is when you want to be having sex, and people want to know how often should we have the frequency of sex. So you want to have sex every day to every other day. Don't have it more often than once a day because the sperm will get depleted. Do it in whatever position feels good to you. There's no position that is better for fertility. There's no need to put your legs up in the air afterwards. The truth is that you just need to get the sperm into the vagina, and really they're going to find their way quickly up through your tubes and to the ovaries. So position doesn't matter. If you can have an orgasm, obviously that's fantastic, but it's not going to affect your fertility. And as Dr. Pedroso said, try to enjoy it. It can be stressful, we know, with the tracking and the calculating and peeing on sticks and all that. So whatever feels good to you is what we want you to do. And of course, we're cognizant that not all types of sex can produce a baby. So if you are having unpartnered sex, if you are having same-sex partner sex, obviously anal sex, oral sex, all the sexes that were never talked about in sex ed are not really baby-making sex. And certainly, if anything in your relationship is interfering with having intercourse, please let us know, let your doctor know. This is something we can help with, whether it's pain, whether it's erectile dysfunction. There's nothing to be ashamed of. That's why we're here. That's why we've trained. We want to help you overcome whatever barriers you're having. So please, that's what we're here for. And we want to have this conversation with you. And I think from here, Dr. Sasan is going to resume.
All right. Hi, everyone. Hope you found this. I've been listening to totally fully. I always enjoy hearing Jasmine and Rebecca talk about these areas. I think they're so fundamentally important. So now that we talked about fertility and sex and learned a little bit more about our bodies, let's just get down to some basic definitions. So what does it mean to be infertile? Infertility is defined based on your age. So if you are 35 or older, infertility would be defined as you've tried to conceive for 6 months and have and have not
I
achieved.
am working and listening.
Oops. There we go. Sorry about that. So infertility for someone who's 35 or older would be defined as 6 months of trying to conceive naturally that did not result in a pregnancy. If you're under the age of 35, infertility would be defined as 12 consecutive months of trying to conceive and not achieving a pregnancy. So 1 out of 8 couples with those definitions would then experience infertility. And a third of couples who experience infertility, it's actually due to the man. And we've spent a lot of time talking about eggs and female reproductive parts, but it's so fundamentally important for all of us to know that if you do have a male partner and you are interested in achieving a pregnancy now or in the future, how important it is for them to also get evaluated. And we do semen analyses at Kindbody. It can be quite easy. You can learn a lot of important information. So just remember that it does take 2 and that the semen analysis is a vital part of this. Now, the key thing that we want to change, and actually Amanda, Lynn, if you can go back a slide, the key thing that we want to change and what we as physicians think is so vitally important is that we don't want you to wait an entire year of trying or even 6 months of trying before you seek care if you're trying to conceive. And so it's so fundamentally important. If you're planning on starting to try soon, or maybe you've already been trying for some time, that there's no harm in coming and seeing us and let us evaluate you and make sure that you're healthy, that everything is fine, that if you're a woman, your egg counts are good, that your uterus and ovaries look fine, that you don't have a cyst or any issues that could prevent pregnancy. And if you have a male partner, that we can assess his semen analysis. Because the key is that if we can diagnose an issue early, then the earlier we diagnose the problem, the sooner we can help you achieve that pregnancy. And so while these definitions are pretty steadfast and we're often told to wait 1 full year of trying before we see a specialist, we really think that we can be more proactive and preventative by making sure we're fine before all that time passes. Next slide. All right, so at the end of the day, the key is there's no magic formula and everyone is unique. So the only way that you can truly learn, well, where do I stand? Am I fertile? Am I not fertile? It's really most important is to not assume that you're fertile because you're young, and also not to assume you're not fertile because you're older. And let's do a fertility assessment specifically for you and find out where you stand. All right, so what is a fertility assessment? This is something that all of us can do for you at any of our Kindbody locations. A fertility assessment, first of all, starts off with a consultation that's one-on-one done with one of our providers. This initial consultation can start virtually, or it can be in person. So that consultation is going over your medical history, your surgical history, what medications you take, what are your allergies, what is your family history? Do you have cancers in your history? Do you have a history of women going into premature or early menopause, which could then impact your fertility, right? What are your family planning goals? How many kids do you want to have? So all of that becomes a vital part of that initial consultation. The second part, if you're in clinic with us, would happen then on the same day. If you started off virtually, then we would schedule parts 2 and 3s for you to do on a later day in our office. The second component is a vaginal ultrasound. An ultrasound is the same thing as a sonogram, which allows us to actually look at the uterus and ovaries, see if you have any cysts, do you have any fibroids, is there anything that could harm your fertility or your ability to conceive or carry a pregnancy. And then we specifically count follicles or premature eggs within the ovaries that will allow us to tell you how fertile you are. What is the likelihood that you could conceive naturally? And what does your fertility look like? The third part is a blood test. It's called anti-Müllerian hormone. It's a blood test that can be done at any time during a woman's cycle, and also in combined with the ultrasound allows us to tell you what is your ovarian reserve, what is your likelihood to conceive. And these 3 things, going over your history, doing that ultrasound, finding out your anatomy, and doing this blood test, become instrumental in us allowing to personalize your care and say, what are the best options for you at this point in your life based on your goals? All right, so then based on our discussions, if you're not ready to conceive now and you do aspire to have 1 or more children in the future, we can talk about egg or embryo freezing. And if you are trying to conceive and we find out that there's an issue where you cannot conceive naturally or you need some help to get pregnant, we could do fertility treatments, 2 examples of which are intrauterine insemination and IVF. Most important thing about these options is a lot of people think or assume that any person who has fertility issues must get IVF. And we want you to know that we're here to be your partners, and there can often be intermediary steps before IVF that may be helpful. And we're always going to tell you all of your options and what are the opportunities for success with each of those options so we can together make a decision that is right for you at the right time. All right, so who should consider egg freezing? Let's start with that. I think there's 4 really important questions that anyone who is thinking about having children now or in the future should ask. Number 1 is, how old are you? Be honest. Number 2, how many kids are in your ideal family? And again, be truthful. It might be 0, which is perfectly fine. But maybe it's, I really, in my heart of hearts, want 5 kids because I'm an only child, or whatever it is. But what is in your ideal family, right? Then number 3, which I think is extremely important, is realistically, how old will you be when you have your first child? And then maybe just as important or more important, if you want more than 1 child, realistically, how old will you be when you have your last child? And we often forget about that last kid, but it's something that we may want, right? And so this becomes really important for several reasons. One is we really have to take into consideration our ambitions, right? If you are working on your education, if you're working on your career aspirations, you want to travel, you're waiting to meet the right partner, and you want more than 1 child, and you're realistically going to be older when you have your first or second child, then egg freezing may be something you should consider. All right, so what is egg freezing? Egg freezing is a concept by which we're basically pressing pause on your fertility. And I have a fun tissue box analogy that I'll show you guys. So imagine this tissue box represents your ovaries. You have a right ovary and a left ovary. At any given moment in time, we have all the eggs that we'll ever have. So in this tissue box right now, imagine if I did an ultrasound on myself, would be all the eggs that I currently have. Because remember, as Dr. Nalkin told us, we're born with all the eggs we'll ever have, and there's no way for us to get more eggs. So what happens is the AMH level that we were just telling you about would be like a gauge, right? When I do an ultrasound, I can see your ovaries, but we can't tell how many eggs are within your ovaries because the eggs are microscopic. So the same way you can't tell how many tissues are in this box. So the AMH becomes instrumental in letting you know, well, how many eggs do you have? Is it 6, full, 5, 4, 3, 2, 1, all the way down to 0. Each month, our body takes a group of our eggs and recruits them. This group of eggs we can actually count on sonogram. So when we do a follicle count, we're telling you how many eggs does your body recruit in a given month. And what naturally occurs is our brain sends a signal to this group of eggs to help 1 egg fully mature. This 1 fully mature egg is the only egg in our bodies that has the capability of becoming a baby. But what happens when you're not having sex or not conceiving, this 1 mature egg is lost. This entire group of eggs are lost. And the next month, your body will recruit again, and the cycle will continue until you run out of eggs. So what do we do with egg freezing? We say, okay, great. So your body's recruiting this group of eggs, which are going to be lost in the next 30 days. Let's be opportunistic and save them for you to use in the future. So key things, remember, only a mature egg has the capacity of becoming a baby. And this reaction of going from premature to mature happens with hormones from our brain. So we give you hormones to help this group of eggs mature together so that once they're mature, which is instrumental, we can extract them and save them for you. So key things, we're not stealing from your fertility. We're just being opportunistic in taking the group of eggs that would otherwise be lost. Next slide. So that's kind of a fun little example of what all this is. So this whole process that I just described to you with my tissue box analogy takes only 10 to 14 days. So in this example, this woman would have stopped her birth control pills where it has the stop sign on a Sunday. If she was on birth control pills, it's not mandatory. She would start her cycle of injections to help her eggs mature on Friday, and she would be done by maximum on 2 Fridays later. But she could actually be done sooner. So the entire egg freezing process, and this is a very common misconception, its maximum takes 14 days from the start. And this is a process by which we're taking a group of your eggs, we're helping them mature, and we're extracting them. Next slide. All right, so the retrieval. So we just talked about taking a group of eggs, helping them mature. Well, how do we take them out? That's a 10 to 15-minute procedure that's done under anesthesia. So you're asleep, don't worry. And it's done with a very small needle that passes through the vagina. And this would be done in our office, in our clinics with an anesthesiologist. And that day, someone would need to take you home. But it's only one day of this entire process that you wouldn't be able to work or do your normal activities. All right, so what comes next? Our hope is that every person who freezes their eggs is able to conceive naturally, meaning if you have a partner, you're able to have sex and get pregnant on your own. But in the event that you're not able to get pregnant, we would then take those eggs that we froze in 2021, thaw them, fertilize them with sperm, create an embryo, genetically test that embryo if it's indicated to make sure it's genetically normal, and then put that embryo back in your uterus to grow. So that would be then the completion of the IVF process. So the key thing is the only difference between egg freezing and IVF is when you want to be pregnant. In a woman who aspires to be pregnant in the future, maybe it's 1 year from now or 10 years from now, she would stop at the egg freezing portion or your embryo freezing portion. And a person who wants to be pregnant today, she would take those eggs, fertilize them with sperm now, create that embryo now, and then put it back in her body as soon as possible because her desire is to be pregnant now. So the only difference between egg freezing and IVF is when do you want to be pregnant? Is it in the future? Then we're doing egg or embryo freezing, or is it today? In which case we'll complete the IVF process. All right. So you have options though. Remember I mentioned to you, I just briefly went over egg freezing and IVF with you, but not all women who have fertility issues need to have IVF. It may just be that you don't ovulate. Sometimes in the cases of women with PCOS, they have issues with ovulation. In that case, we can help you get pregnant by just giving you medication that would help you ovulate and then telling you exactly when to have sex, which would be timed intercourse. Or intrauterine insemination can be a helpful treatment. Let's say you are a single woman who wants to conceive on her own and otherwise is healthy and fertile. We could do an insemination with donor sperm or sperm from your partner, and then IVF as we just talked about. Now, the key thing is there's lots of family building options. So we can do donor egg. If you are a same-sex male couple, can use donor egg with your sperm and a gestational carrier or a surrogate. You're a same-sex female couple, you could use donor sperm. Or you might be an older woman who aspires to carry a pregnancy and your fertility is poor. You may use donor egg with your partner's sperm or donor sperm to conceive. So there's lots of options. We're here to hold your hand every step of the way. I know all of this can be kind of a lot of information and can be anxiety provoking, and our team is really here to help you simplify it, better understand it, and pick the right care at the right time with the right providers. All right, so your next steps, whether you are actively trying to get pregnant or you're actively trying to not get pregnant and wish to get pregnant 10 years from now, the key is that we're never too young or too old to learn more about our bodies. And there's no better time in the present to understand what is my fertility? Where do I stand? Where does my partner stand? What are our options? What are our family planning goals? And learning more even just simply about orgasm, as Dr. Pedrosa was talking about, or just learning more about your body. The key is that there's no better time than today. Because unfortunately, especially as it comes to women, time is not on our side as it relates to our fertility. All right. Little quick discussion about cost. The fertility assessments at Kindbody are covered by insurance, and we do accept all the major insurances. But in the event that you don't have insurance, it's $150 with the code SEXED, SEXED. An egg freezing cycle, you get discounted, is $6,000, so it's a $500 discount. With IVF, it's $12,500, again, another $500 discount, and IUI is $1,000. So if you go to our website, kindbody.com, and schedule an appointment, and you enter sex ed, the appointment would just be to come and see us for a consultation. And then if you choose to do an egg freezing, IVF, or IUI in the future, we would then honor those discounted rates. But remember, the first step is to just come in, learn more about your body, let us help you explore your options. And that can be done simply at kindbody.com in all of our locations, and all of that is easily done through the website. Next slide. We do accept all the major insurances, as I told you before. And if you do have any questions about maybe employer benefits, or you work somewhere where you do have egg freezing or IVF benefits, we can help you explore those as well. And you can also use your FSA or HSA accounts to pay for any part of the visit or any services that you have with us. All right, we'll open it up to questions. I'm going to welcome Dr. Nalkin and Dr. Pedroso back. And I think Amanda Lynn, who's part of our marketing team, is going to be our guide. So Dr. Nalkin and Pedroso, if you want to unmute yourselves, we'll take it away with questions.
Yeah. So there was a question. I was trying to type the answer, but it's just taking too long. There was the question about, if you freeze your eggs, does the age at which you use them prior to menopause matter, or is it the age of the eggs that's important? I always tell my patients that when we're freezing our eggs, we're freezing them in time. So if you're freezing them at 30 years old, they will always be 30 years old. But to answer the other part of the question, does the age at which you actually use those eggs matter? And it actually does. Yes, it absolutely does. Because I can tell you that in the risks that we think of as OBGYNs, we are the baby's mom, right? The little fetus that's growing, or sorry, not mom, we're the baby's doctor and the mom's doctor. When you freeze your eggs at whatever age, they're stuck in time, but we cannot freeze you, right? We can't freeze your uterus. So if you were to use your 30-year-old eggs, fantastic. There's decreased risk of miscarriage, decreased risk of chromosome abnormalities. But if you use it at 45 years old, you will still have all those risks of a pregnancy at 45 years old. Those risks would be increased risk of high blood pressure, increased risk of preterm labor, increased risk of C-section, increased risk of stroke and seizure during pregnancy, and increased risk of diabetes. Now, all of those risks can be mitigated with really good prenatal care. This is not to scare you away from pregnancy at an older age. I'm definitely guilty of that twice. So definitely, again, not to say that you shouldn't be pregnant, but freezing your eggs does not freeze your uterus. Just want to make that clear.
Thank you. Very helpful. So in terms of that, if you have irregular periods, how do you know if you're fertile? And can someone tell when they're ovulating if their period is inconsistent?
Dr. Nalkin, you want to take that one?
Do you want to take that one?
Yeah, sure. So if you're having your period, do you know if you're ovulating? So there are 5 ingredients to make a baby. Your eggs, you need good eggs, you need a good uterus, you need some open tubes, you need some good sperm, and some way for the egg and the sperm to meet. Sometimes that's sex, sometimes that's insemination for same-sex couples. The eggs and the health of your cycle will actually dictate your period. So when you ovulate, you have a period. But that's one ingredient. You still need open tubes. You still need good sperm. So your eggs only, it gives us an idea of your ovulation if you are having regular periods. But again, it tells us nothing about the other ingredients to make that baby. So we do recommend, if you are trying and you're having normal cycles, don't forget those other, don't forget that men, about 30%, there's a male factor involved, meaning that there's low motility, low sperm count, that kind of thing. Sometimes it has nothing to do with your eggs. Sometimes you have fabulous eggs, but the tubes are blocked. And this is what we take into account whenever we do a fertility assessment.
Thank you. Does being on a birth control mean you conserve your eggs?
You can do what to your eggs?
Does being on birth control mean you're conserving your eggs?
No. No, being on birth control pill does not conserve your eggs. Unfortunately, you still, the number, the quantity and the quality of the eggs are going to decline with age. there is nothing that we can do to slow that process. We are able to kind of freeze in time by doing the preservation, but no, even if you're on the pill, it's not going to stop the decline of your eggs, both quantity and quality.
Will taking a prenatal vitamin on a daily basis preserve the quality of those eggs?
Oh, that's a really good question. And unfortunately, there's nothing that we can do, whether it's diet or exercise or being vegan or being extra good. While I encourage all of you to be as good as possible and to eat well and exercise and understand that it's just as bad to be underweight as it is overweight. All of these things are so fundamentally important, not smoking, drinking in moderation. Unfortunately, there's nothing we can do. There's no medicine we can take. There's not even a fertility treatment that we could offer you to make you have more eggs or to improve the quality of your eggs. So taking prenatal vitamins is important for the development of the spinal column and brain of a developing fetus, but it doesn't actually make us more fertile or improve our egg count or quality.
Thank you. A few people here have had some failed IVF. What are some of the causes for IVF failure?
I can take that. So the reason why IVF can sometimes fail is that, remember, at the end of the day, there's a lot of factors that play a role, right? The most important factor in the success of IVF is really going to be the age of the egg. So how old were you when you froze your eggs, or how old are you today when those eggs are extracted, which is then going to play a tremendous role in the quality of those eggs. But remember, we can't test the quality of eggs, right? So IVF failure is typically going to have to do with the age of the woman and how many eggs did she have. The younger you are, the more likely that you'll have a lot of eggs. The younger a person is and the more eggs she has, the more likely that IVF would be successful. But even then, we have to realize that even with the perfect egg and the perfect sperm and a genetically normal embryo, while those things do significantly improve the success of IVF, there's never an absolute 100% guarantee. And that's the part that can be really frustrating, and the part that we really want to help you better explore and understand as we meet with you one-on-one.
Thank you. A couple more here. If my husband drinks and smokes, is that going to slow the process of us getting pregnant?
I can take that one. So sperm quality, Dr. Nelkin, you want to do?
Yeah, go for it.
So the health of our eggs, like Dr. Sasan was saying, we can be the healthiest people in the world, and our eggs will still decrease in quality and quantity over time. But with men, it's a little different. Their current health will determine the health of their sperm. So, for example, if you're smoking and drinking and sitting in hot tubs, daily, and or any other kind of toxic exposure to the testes, you can actually reverse all that, and we would say, hey, your motility count is real, or your motile count is really low, the sperm quality is really low. Stop all those toxic habits. We'll recheck in 2 to 3 months. So yes, smoking and drinking absolutely can. The degree to which it affects the sperm quality is different for everybody. So if you are unsure, we definitely recommend coming by and doing a semen sample with us. We run it ourselves, and we can get the results back to you pretty quickly if you're just curious about that.
Thanks. And along the lines, is egg freezing and IVF helpful if your male partner has lower fertility, so has lower mobility of their sperm?
Yeah. Do you want to take that one, Dr. Sasan?
Yeah, so absolutely. Anytime where either member of the couple has an issue, so whether it's a woman has a low egg count, or a man has a poor sperm count, or maybe has the abnormal shaped sperm, but anytime there's an issue, then fertility treatments are going to help. And depending on the issue will let you know what is the fertility treatment that is right for you at this time. So it's, again, the answer is not always IVF. It may be something else, but that's where knowing the specifics, knowing the actual facts, what is the male problem if it's a male problem? What is the female problem if it's a female problem? And then helping us put all of that together. We call it doing your homework. We have to get, remember, Dr. Pedrosa talked about there's 5 factors. There's the egg count, there's the uterus, there's the fallopian tubes, there's the sperm. So doing all of our homework then allows us to tell you, okay, based on your facts, not based on Dr. Google, but based on your facts, here's the best treatment for you.
Great. I think we have a couple more here. Is it possible to purposefully have twins with IVF?
It is possible. Sorry, I apologize. I'll just take this one. Dr. Nelkin, you definitely have the last word tonight. It is certainly possible, but we don't advise it. So at Kindbody, remember, our goal is not to achieve a pregnancy. Our goal is to have a healthy live birth 10 months after we put in that egg. And we know that successful, healthy pregnancies result from singleton babies, meaning one baby in one uterus. Twin pregnancies have high risk of preterm labor, preterm delivery, NICU admissions, and all of the sequelae that can come from that. And so as a result, and this is supported by the American Society for Reproductive Medicine, we advocate for transferring one embryo when we do IVF, which then helps us improve the chances of having a successful live birth.
Does knowing you have a low AMH mean you have low egg count?
That's an excellent question. So the AMH is like measuring, looking at the gauge on your gas tank of your ovarian reserve. And typically we kind of look at it from 0 to 6. It can go much higher, but it is not a direct measure of your egg count. The way we measure egg count is by doing an ultrasound, and we literally do what's called an antral follicle count. We will look at both ovaries and literally count how many follicles are in each ovary. And again, remember, that's not how, if we say you have 16, that's not how many you have left overall. That is how many, the cohort that your ovaries have recruited that 1 month going towards ovulation. So the AFC is how we measure your egg count. The AMH usually correlates with your egg count, but it's not a direct measure. It's a gauge on the gas tank. And AMH really tells us more about how you might respond to treatments that we're going to do, and it helps us guide the dosing if you're going ahead with treatments with us with egg freezing. It helps us kind of figure out how best to do that for you.
Great. Okay, we have 2 more here. One, I have a slightly high FSH. How does that affect conception and egg freezing? Should they wait until they have it? I think they probably mean THS, FSH here, but should they wait to have that lowered with their endocrinologist before they move forward with egg freezing?
So I can answer that. So FSH is one of those hormones that are actually released by the brain. It's called follicle stimulating hormone. It actually stimulates those ovaries to then release your estrogen, progesterone at different times of your cycle. When we see that the FSH is elevated, it is concerning, because as it becomes elevated, it's an indication that the ovaries are not responding as well. So at different times of your cycle, it can be high, it can be low. It really depends on when they actually drew that FSH. So FSH by itself is not a good proxy for your fertility, but it can be used and followed over time if it's drawn at the same time every single month to see if you would be at increased risk for premature menopause, for example. Usually we'll see menopause, perimenopause in numbers around 15 to 25 or so. Definitely menopausal women will have FSHs greater than 30 to 70. But again, it's our body's way of basically it's a signal that your body is secreting so much FSH from the brain, but yet the ovaries are not responding. So that's a loaded question, and my advice would definitely be just to kind of follow up and do a full assessment, and don't judge your fertility just by one number.
Yeah. Okay. And then the last question of the night here, guys. If I just had my COVID vaccine, how long should I wait to start my egg freezing cycle?
So as everyone knows, everything is changing constantly with COVID. But right now, what we're advising is to wait 2 to 4 weeks from your vaccination before you start a cycle. But honestly, if you just got your vaccine, by the time you come and see us, we get everything started, that 2 to 4 weeks would pass. So you'll be good. It's a quite short period of time.
Great, thank you. Thank you, everyone.
Wonderful.
I'm on mute. Yeah, sorry. Thank you so much. We're going to end the night there. We really appreciate everyone joining us. If you continue to have more questions, you can always reach out to us, navigator@kindbody.com. We encourage everyone to use the code SEXED, come in, have your full workup done, meet our wonderful doctors, and just see where you're at. Know your fertility.
Thank you, guys. Have a wonderful afternoon or evening, depending on where you are. And thank you for sharing your time with us. We hope this was helpful. Take care. And happy belated International Women's Day. Thank you guys again for joining us. Bye-bye.